Why does Parkinson's medication cause dyskinesia? Have you ever wondered why some people with Parkinson's disease experience involuntary movements after taking their medication? This phenomenon, known as dyskinesia, is primarily linked to the long-term use of medications like Levodopa, which is a common treatment for Parkinson's disease. To understand this, we need to look at how Parkinson's disease affects the brain and how medications work. Parkinson's disease is characterized by the gradual loss of dopamine-producing neurons in a part of the brain called the substantia nigra. Dopamine is crucial for controlling movement. As these neurons die, dopamine levels drop, leading to the motor symptoms associated with Parkinson's. Levodopa is converted into dopamine in the brain, helping to replenish this deficit and improve movement. However, over time, the brain's response to levodopa can become irregular. One major reason dyskinesia occurs is due to changes in dopamine signaling. Chronic use of levodopa alters both the presynaptic and postsynaptic pathways in the brain. This means that the way dopamine receptors respond to stimulation changes, particularly in the striatum, which is essential for movement control. This can lead to excessive and erratic stimulation of the motor circuits, resulting in involuntary movements. Additionally, long-term levodopa treatment can cause neuroplastic changes in the brain. This means that the brain adapts to the medication in ways that can lead to dyskinesia. Certain proteins in the brain become overexpressed, which alters how neurons behave and can disrupt the balance of signals that control movement. Another contributing factor is the way levodopa is administered. It is often taken in doses that cause fluctuating dopamine levels, high peaks followed by low troughs. This pattern of stimulation does not mimic the brain's natural releases of dopamine, leading to maladaptive responses in the brain's signaling pathways. The severity of dyskinesia can also depend on individual factors such as the progression of Parkinson's disease, the duration of levodopa treatment, and the age at which the disease began. Younger patients and those who have been on levodopa longer are generally more likely to experience these involuntary movements. It is important to note that dyskinesias are not symptoms of Parkinson's disease itself, but rather complications that arise from its treatment. They often develop after several years of levodopa therapy and can vary in intensity from mild to severe. Managing dyskinesia typically involves adjusting medication regimens to find a balance between controlling Parkinson's symptoms and minimizing involuntary movements. Sometimes, additional medications or even surgical options may be considered to help manage these side effects. In summary, dyskinesia occurs as a result of long-term dopamine replacement therapy, which leads to abnormal receptor stimulation and changes in brain pathways. These factors, along with the progression of the disease and individual patient characteristics, contribute to the development of these involuntary movements. If you or someone you know is experiencing dyskinesia, it is essential to consult with a healthcare professional to explore the best management strategies.